Every second that passes, somewhere in the world, someone is facing a stroke, a sudden and devastating medical emergency. 1 in 6 people will experience a stroke in their lifetime. This isn't just a concerning statistic, it's a warning we cannot ignore. Stroke, one of the leading causes of death worldwide, is becoming a serious health threat. What's even more tragic is that, although strokes are preventable, their impact is immense, leaving heavy consequences for both the patient and their family. When people hear the word stroke, many think of severe cases, where a person loses the ability to move, speak, or even survive. But few realize that strokes can occur quickly and silently, sometimes without clear warning signs beforehand. Every second, every minute could be the difference between life and death. Amidst all the frightening facts, one thing is clear. Strokes can be prevented if we understand the causes, symptoms, and how to respond in a timely manner. In reality, strokes aren't just a threat to the elderly or those with underlying health conditions. Anyone, at any age, can become a victim. So why is stroke so dangerous? It occurs when blood flow cannot reach a part of the brain, leading to the death of brain cells. This can have severe effects on the body's and mind's functions. But what makes stroke especially dangerous is the lack of knowledge and understanding of the early warning signs, which causes delayed emergency responses and leads to unpredictable consequences. That's why raising awareness about strokes is so important. We need to recognize that anyone can be a victim of this disease, and every minute, every second is a precious opportunity to save a life. The statistics on stroke rates and death frequency are just part of the bigger picture of this disease's impact, but one thing is clear. Strokes can rob us of the ability to live a normal life, or even take our lives altogether. So, the big question is, how can we protect ourselves and our loved ones from this danger? The key is awareness and timely action. In this video, we'll explore the causes, symptoms, and treatments for stroke so we can face it effectively. Every second counts, and knowledge could be the difference between life and death. Stay tuned to learn how to protect your health and prevent stroke in your life. The brain's mechanism. Why is the brain so important? Although it only accounts for about 2% of the total body weight, the brain consumes more than 20% of the oxygen in our blood. This is an astonishing number, and it clearly reflects the importance of the brain in maintaining the overall function of the body. The brain is not only the control center for all vital functions, but also the place where all our thoughts, emotions, and actions occur. Therefore, any disruption in the supply of oxygen to the brain can lead to serious consequences. The oxygen needed to maintain brain function is delivered through a network of blood vessels in the body, primarily the carotid arteries and vertebral arteries. The carotid arteries are responsible for supplying blood to the front part of the brain, while the vertebral arteries supply blood to the back part. These two systems work together to form a complex network, ensuring that brain cells always receive enough oxygen and nutrients to function properly. This arterial system is not only crucial for oxygen delivery, but also for transporting essential nutrients like glucose and removing waste products from the brain's metabolism. When there is a disruption in blood flow, whether due to a blockage or a ruptured vessel, the brain will immediately suffer from a lack of oxygen and nutrients, leading to the cessation of brain cell activity. This is the cause of a stroke. However, because the brain lacks pain receptors, we cannot immediately feel when there is a disruption in the oxygen supply. As a result, the body cannot signal to us that something is wrong, making it difficult to recognize stroke symptoms in time. This is why understanding the brain's mechanism and the blood vessels that supply oxygen to it is crucial for detecting and addressing problems promptly. Prolonged lack of oxygen can cause severe damage to brain cells, even leading to their death. This results in issues such as loss of movement, inability to speak, or even memory loss. The longer this condition persists, the more severe the damage becomes, potentially leading to permanent disabilities that affect the patient's quality of life. In the next section, we will delve into the causes of stroke, from blood vessel blockages to ruptured vessels, and how our body responds to these situations. Understanding this will help you become more aware of the stroke risks and effective prevention methods. Continue watching the video to gain important knowledge on how to protect your health and that of your loved ones. Types of strokes and their differences. A stroke is a serious medical condition that can occur suddenly, and they can be classified into two main types: hemorrhagic stroke and ischemic stroke. Each type has different mechanisms and causes, and understanding them will help us recognize the severity of the condition and the preventive measures we can take. Hemorrhagic stroke, causes and consequences of a ruptured blood vessel. Hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing blood to leak out of the vessel and into the surrounding brain tissue. This type of stroke is less common but particularly dangerous because when blood escapes from the vessel, it not only directly damages the brain but also increases intracranial pressure, leading to further damage to brain cells. The main causes of hemorrhagic stroke are chronic high blood pressure, weak blood vessels, or the presence of an aneurysm in the brain. When the pressure in the arteries rises abnormally, it can cause the blood vessels to rupture, leading to bleeding in the brain. Additionally, people with blood clotting disorders or those on blood-thinning medications are at a higher risk of experiencing a hemorrhagic stroke. The consequences of hemorrhagic stroke can be extremely severe, causing rapid brain damage and even death if not treated promptly. Typical symptoms of this type of stroke can include severe headaches, vomiting, and loss of ability to move or speak. Ischemic stroke, causes due to blocked blood vessels. While hemorrhagic stroke is caused by a ruptured blood vessel leading to bleeding in the brain, ischemic stroke is the most common type and occurs when a blood clot or cholesterol plaque blocks blood flow to a part of the brain. When blood vessels are blocked, the brain is deprived of oxygen and nutrients, causing brain cells in that area to die. Ischemic stroke can be further divided into two subtypes: transient ischemic attack, TIA, and complete ischemic stroke. TIA, also known as a mini-stroke, occurs when the blood clot temporarily blocks blood flow, and the symptoms will resolve after a short time. However, TIA is a warning sign that a full stroke may occur in the future, and it requires immediate attention. In contrast, a complete ischemic stroke happens when the blood clot completely blocks a blood vessel, leading to prolonged symptoms and potentially causing permanent brain damage. Ischemic stroke can have symptoms such as muscle weakness, difficulty speaking, paralysis on one side of the body, or loss of control over vital organs like the eyes and mouth. If not treated promptly, the lack of oxygen in the brain can result in severe complications or even death. Differences between the two types of stroke. Although both hemorrhagic and ischemic strokes can cause serious brain damage, they have different mechanisms and ways of developing. Hemorrhagic stroke primarily involves a ruptured blood vessel and bleeding in the brain, while ischemic stroke is primarily caused by a blood vessel blockage. What's important is that both types of strokes require immediate medical intervention to minimize brain damage and improve the chances of recovery for the patient. Causes of blood clot formation and mechanism of blockage. Blood clots are one of the primary factors leading to ischemic stroke. However, blood clots don't always form in a simple manner. There are many causes that can lead to the formation of blood clots in the body, and one of the most important causes is arrhythmia. Arrhythmia, or atrial fibrillation, is a condition where the heart beats irregularly, not following a normal rhythm, leading to inefficient blood pumping from the heart. When the heart doesn't beat in a regular rhythm, blood will not circulate evenly throughout the body, causing blood to slow down and possibly accumulate in the upper chambers of the heart. This creates an ideal environment for platelets, small cells in the blood that help with clotting, and fibrin, a protein involved in the clotting process, to clump together and form blood clots. These clots can be small but have a significant impact because they can easily break loose and travel into the bloodstream, especially to the brain. As the blood clot moves through the blood vessels, it will encounter smaller arteries in the brain, where the blood flow can no longer pass through the clot. When the clot blocks blood flow to a part of the brain, it causes a lack of oxygen and nutrients to the brain cells, leading to cerebral ischemia. If this condition persists, brain cells will be damaged and die, resulting in severe consequences such as loss of movement, speech disorders, or even death if not treated promptly. Arrhythmia is a key factor because it reduces the heart's ability to pump blood regularly, and this is one of the causes of arterial embolism, where the blood clot from the heart can break off and travel to the brain. These blood clots can originate from other parts of the body, especially the heart if there are coronary artery diseases or heart-related issues like valvular heart disease. Once the clot enters the arteries supplying blood to the brain, this blockage can lead to ischemic stroke, which is the most common type of stroke. Understanding the mechanism of blood clot formation is crucial for preventing and treating such dangerous conditions early. In the case of arrhythmia, timely treatment and well-managed risk factors such as high blood pressure, diabetes, or lipid disorders can help reduce the risk of blood clot formation. At the same time, medical treatments such as blood thinners can help prevent blood clot formation and protect brain health. Blood clots can be a dangerous foe, but with an understanding of their formation mechanisms and prevention methods, we can protect our health and minimize the risk of unfortunate strokes. Symptoms of stroke and how to identify them early. A stroke is a sudden medical emergency, and early recognition of its symptoms can determine a patient's survival and recovery potential. However, it's important to note that the brain does not have pain receptors, meaning the brain cannot feel pain in the same way that other parts of the body can. However, when the brain is deprived of oxygen due to a stroke, its functions deteriorate, causing a range of abnormal symptoms that can be easily noticed if those around the person are attentive. One of the most common symptoms of a stroke is slurred speech or difficulty speaking. If someone suddenly has trouble speaking, cannot speak fluently, or speaks unclearly, this is a sign of brain damage caused by the stroke. When the brain is not getting enough oxygen, the areas responsible for controlling the mouth and tongue muscles do not function effectively, making it difficult to speak. This is critical because slurred speech or the inability to communicate can be an early warning sign of a stroke and requires immediate treatment. In addition to slurred speech, muscle weakness is another very important sign of a stroke. Often, muscle weakness will appear on one side of the body, meaning one arm or one leg will suddenly become weak or unable to move as usual. If you notice someone unable to lift their arm, unable to walk, or losing strength on one side of their body when they were previously healthy, this could be a sign of a stroke. This occurs because when part of the brain lacks oxygen, the nerve signals controlling bodily movement are interrupted, leading to a loss of muscle control. Moreover, a stroke can also cause other symptoms, such as loss of balance or dizziness. The patient may feel dizzy, lose their balance, have trouble walking, or feel as if they are spinning. Loss of vision or blurry vision in one eye. Due to the lack of blood supply to the brain, vision may be affected, and the patient may not be able to see clearly or may lose vision in one eye. Sudden and severe headache. Hemorrhagic stroke, when blood leaks from a broken vessel into the brain, can cause a severe headache, particularly when the headache comes on suddenly and with no clear cause. The symptoms of a stroke may vary depending on the area of the brain affected, and the severity of each symptom can differ. However, detecting and identifying these symptoms early can help minimize brain damage and improve the chances of recovery for the patient. This is why it is important for everyone to be familiar with the early warning signs of a stroke, so they can act immediately. When noticing any of the symptoms mentioned above, call emergency services immediately. Every minute counts, as the brain continues to be deprived of oxygen, and timely medical intervention can save the patient's life and help minimize the long-term damage caused by a stroke. In the next section, we will explore the treatment methods for strokes, including medical interventions that can be applied to prevent brain damage and improve the chances of recovery for the patient. The body's response and impact when timely intervention is not provided. When a stroke occurs, the body immediately starts responding to try to protect brain cells from damage. However, this response is not always enough to prevent severe consequences if medical intervention is not provided in time. As soon as part of the brain becomes oxygen deprived due to a blocked blood vessel, the body attempts to reroute blood flow to the affected area. Specifically, the blood vessels around the blocked region will try to expand to supply blood and oxygen to the starved brain cells. This is a natural defense mechanism of the body to try to save brain cells in an emergency. However, although the body may try to adjust, this rerouting of blood flow is not always effective. If the blockage is not resolved, brain cells will continue to lack oxygen and gradually die. The rapid death of brain cells will lead to permanent damage, causing severe neurological dysfunction. This can result in difficulties in movement, speech, or even loss of cognitive ability, depending on which part of the brain is affected. The reason brain cells die quickly is because the brain has a very high demand for oxygen. Despite accounting for only about 2% of the body's weight, the brain consumes more than 20% of the oxygen in the blood. When oxygen supply is cut off due to blockage, brain cells cannot function normally. After just a few minutes without oxygen, these cells will begin to die, and brain damage will become irreversible. This is why timely medical intervention is so crucial during a stroke. Every minute that passes increases the number of brain cells dying, making the condition more severe. Therefore, early detection and immediate transport to the hospital are key factors in minimizing brain damage and improving the chances of recovery after a stroke. If not properly managed, stroke patients can experience long-term consequences such as loss of mobility, slurred speech, memory impairment, or even death. Moreover, these damages not only affect the patient but also their family and society, placing a heavy burden on the entire community. Therefore, the body's response is just one part of dealing with a stroke. Without proper support and treatment, the body's efforts will not be enough to prevent permanent brain damage. Emergency stroke treatment. When a stroke occurs, timely medical intervention can save the patient's life and prevent permanent brain damage. To achieve the best outcomes, Treatment needs to be administered as early as possible, especially within the first few hours after stroke symptoms appear. There are two main emergency treatments that doctors may use: tissue plasminogen activator, TPA, and mechanical thrombectomy. Tissue plasminogen activator, TPA. Tissue plasminogen activator, TPA, is the most common treatment for ischemic stroke, the type of stroke caused by a blood vessel blockage. TPA works by breaking down the blood clot that is obstructing the blood vessel and restoring blood flow to the brain. However, this medication is only effective if administered within 3 to 4.5 hours of the onset of stroke symptoms. Therefore, quickly recognizing the signs of a stroke is extremely important to ensure this method can be applied in time. TPA works by activating the body's natural mechanism to break up blood clots that are obstructing blood flow. Once the clot is removed, blood can flow freely into the brain, providing oxygen and nutrients to the brain cells, helping to stop the damage and potentially restoring the affected functions. While TPA has very promising results, not everyone is eligible to receive this medication, particularly those with a history of brain hemorrhage, clotting disorders, or those who use blood thinners. Mechanical thrombectomy. For patients who cannot receive TPA due to other health factors, doctors will use mechanical thrombectomy. This procedure is performed by inserting a thin, flexible catheter through the blood vessels to the location of the blood clot. Once the clot is reached, the doctor uses a special device to remove the clot, helping to restore blood flow to the brain. This procedure is performed under the guidance of imaging techniques such as X-ray or MRI, which allow doctors to clearly see the location of the clot and decide on the most appropriate intervention. Although this procedure is quite complex and requires advanced equipment, it has saved many stroke patients and minimized permanent brain damage. Both of these treatment methods require timely and precise intervention. This underscores the importance of early detection of stroke symptoms and getting the patient to the hospital immediately. In many cases, proper and timely treatment can help patients recover better, reduce the long-term consequences of a stroke, and even when damage is inevitable, survival chances and quality of life can be significantly improved. Thus, early detection and timely intervention are the key factors for successfully treating a stroke. Recognizing stroke with the FAST method. When a stroke occurs, the speed of intervention can be the deciding factor between life and death. Therefore, immediately identifying the signs of a stroke is crucial. One of the simplest and most effective methods for recognizing a stroke is the FAST method. This is an incredibly helpful tool that helps us detect stroke symptoms from the first signs. F. Face. Ask the person to smile. Check for any signs of facial drooping. One side of the face may sag, creating asymmetry. This is a clear sign of muscle weakness in the face, commonly seen in stroke patients. A. Arms. Ask the person to raise both arms at the same time. If one arm cannot be lifted or feels weak and uncontrollable, this is a sign of a stroke. This happens because the stroke affects the area of the brain that controls movement. S. Speech. Ask the person to repeat a simple sentence like, "Hello," or "I feel fine." If their speech becomes slurred, hard to understand, or unclear, it may be because the area of the brain responsible for speech has been affected by the stroke. T. Time. If you notice any of the signs above, call emergency services immediately. Time is the most critical factor in stroke treatment. Every minute that passes can increase brain damage. Early recognition and timely intervention significantly improve the chances of saving the patient and minimizing damage. A stroke is a medical emergency that we cannot ignore. Every second, every minute is crucial. Always remember the FAST method to recognize a stroke as soon as symptoms appear. If you or a loved one show signs of a stroke, don't hesitate. Call emergency services immediately. Quick response can save lives and help minimize the severe consequences of a stroke. Share this video with your family and friends to help them understand how to recognize stroke signs and respond effectively in this situation. Don't forget to like and subscribe for more useful health information and self-care tips. While we may not be able to prevent a stroke, we can learn how to react quickly and effectively.